entire weekend after the terrible tenor AC Western region. Thursday, Friday, nipa ofri mu ewa abra yede na eko hospital yese o ya free we was so ma ye kodu ho doctor ni ho. Enti me spend Friday night, Saturday and a Sunday. Adwuma na media ne se me ne doctor for aiding komo. Omo ye me doctor friends, any omo ye me doctor friends ne friends. Enti me ni we kasa na odi we number mame. And I mean nurses, many of my in Komokra bears 20 nurses across Ghana. And a doctor for so bear 10. Now, Omuninasu spread across the regions. Now, there is only one conclusion me draw here. And opay the metimaka chance we Ghana near. We are near the Oko hospital. So we be a area near the Nako hospital da. And now say we will be a potentially. Uko hospital na watwi mu a de wose wotie me ne se ka ukopa yarehwe but the hospitals are sicker. We have sick hospitals and we have to admit after calls na me ye ne de me ye ni nyina na me sign I receive several research and study na Enyama we ne wase ye manu here as oman because e affect obia. We have very sick hospitals, very sick health system. We must admit, enyame na meka, Ghana Statistical Service, Ghana Health Service reports, and a health risk reports are yedema travelers. World Health Organization reports. Ghana has a very sick health system. And to what we are yarehwe no. Baby awokwaja yaresa no omo yare chen o. Antie weekendi and a defense minister Dr. Omane Boama yeso pay courtesy call ewo 37 military hospital. Na okoho a yesi oxygen plant ho no asay for some years. Anti-oxygen, a hoarding, 37 of all hospitals. If not the third best in the country, oxygen anyhow. A one ujina ne naso, ema, abrofo moton, oxygen plant ibi, omudi kosi ho. Na mi busa se, nti adie bisa no, wasa adie chenso, oxygen planter. There is a likelihood say obi betimi ewu because of that. So many people have died in Ghana before their death. Men mo bia nyina baby nkase. Nyame na de ma ono ana agye. Nipa bebre wu o man mu ha. Omu wu before so omu time beso and you are aware say some of the deaths are avoidable. Ewu ni bi wo ha ye nipa bi wu a. O krofoforo bi aso anko ye saved. 37 military hospital plant oxygen asay and omo ye adwuma nti no e affect health delivery ewo ho doctor for na e kan o ansa na doctor Omane Boama e kwa akoto so a defense minister no omo makofa plant o makoto na animu ya ade aba the facility there a omo koye no 2018-2019 no was around 480,000 euro and I break it down and I say Kolebu Teaching Hospital make us say one of the worst hospitaler yetino over 100 years and one of the oldest hospitals in Africa, the oldest in West Africa, oldest teaching hospital in West Africa. So uko hu omo conditioner and nani e kase urahane kwaja yaresha wan kasa no utimu se baby ameko no oho ye sick than me yare no. Share images of Kolebu Hospital in 1932. 1932. Look at the images of Kolebu Hospital. Share ward 1932. Kolebu. This is the current state. Yang kwani 1932 Kolebu Teaching Hospital. Said the na state no etie. Na fabe compare enne. Dr. Fona meni omo kasa ni nyina ne se Ghana is having a sick health system. And it is better that we all talk about it to help cure the people who are supposed to cure our sick. Sesi America say, Nico, me pacho mama me Kolebu picture no 1932 dear no. Mama me the old picture of Kolebu, young older hospital ewa Ghana. Now the state of the hospital now, ya two renal unit. Yet me too say ye nyas kanto renal unit. This is when Kolebu was I think 1923. Gordgesburg ebie Kolebu ano 1923 we were constructing hospitals like this. And you see the word, more show on Facebook ni TV no. This was the hospital environment in 1923. And then to me see webi. This was in 1923. And you see the word said the Serenity she Kolebu ward in 1932. She ventilation, she lighting, she equipment, she beds. This was in 1932. And then you check Kolebu chao today. No abusa who say omai no or kon anymore na or banechi. This was Kolebu. Male ward. The ocean the first one here. Go back to the female ward in 1932. This is the male ward. Oko female ward. This is the female ward in 1932. She ventilation. She the way just a wood ha a dear pan a chair say yare na o yare no. She floor. She way cry your color picture. More show TV no, you will get a better representation of how healthcare was prioritized. Because enema ema o mine enwuse o tumpon say obi arena ne time on so ya yebesi evu no. She equipment in 1932 abronini bibini doctors she nipa ene I can say emphatically, and this is from doctors in Kolebu almost say go and say it for us because one year don't ha. This was in 1932. Pictures are more. Dr. Foni say mon kona mon ko kana money ye dem beba ha. Kolebu any CT scan. Kolebu Teaching Hospital, the biggest referral hospital in West Africa, and I say in Ghana. One of the best in West Africa. Omuni CT scan ewo Kolebu Teaching Hospital. CT scan ona ene yedi obi shem se baby a cancer o se ni trimo o se ni mu o na atwa mfonyini mo small hospitals, county hospitals ewo Abrochire South Africa mo county hospital na omo CT scan. Doctor ne say se ene wo yare ne de oba Kolebu anopa ya de make catch on say se oda emergency and life support so. Now we hear CT scanner. De ohone ye. This year the auto ambulance near the oko Legon. Private hospitals be ansa ne akotwa. Enti oda life support so near here CT scanner Kolebu ni bi. Enti they have lost many patients in the transit. Abro mo kotwa CT scan ewo East Legon ana hospital. Ewo airport no. Because Kolebu any CT scan and the cost of CT scan will be less than $500,000. And this is a country that loses over $3 billion a year to corruption. A country that loses $3 billion to corruption. And in America, Integrity Initiative for Research, high quality research. Ghana loses $3 billion every year to corruption and bribery. Corruption. Sika, yes, a choir contract here, dino, $3 billion. Not just say every day, Ghana loses $8 million to corruption. People steal $8 million every day. So calculate $3 billion divided by 365 days. So my calculation here correct. It just over $8 million ye run every day. I co individuals pockets. But ye yaria, ye need CT scan. Ye renal unit or more yari kidney diseases no ya tum because ye nyasika nto machine say nguho nti omo kidney aye omo kidney problem no mo na ekwaye demonstration o my way yetimi ma pension for kodi la ye demonstration pensioners na ye impanyufo no young boys na yetifie yenim say enru ye so nti the doctors are telling me say come and say it today say Ghana's health system itself is sick. Say oh share page bed system na ema obi wu western region and the obi ewu mo kai say aye normal wo Ghana ye de na akọ ye do 37 years so mu nimpa ye de ne call rage yase mpani ho ye de ne call kolebu yase mpani ho no. This is the record. Averagely nipa 10,000 bi omo wo Ghana no 10,000 people bi ano empa 2 ene wo homo mo. Nti se nipa 10,000 yare bomu ne e wo Greater Accra. Omo ye entitled to entitled to available empa or ye 2.5 empa. Every 10,000 sick patients empa 2 na available. And make the calculations. Nipa 10,000 biano empa 2. Not just 1,000 biano 0.9 empa no 1 for you. This is the statistic for Ghana. Very damning statistics. 10,000 people be omo yare no empire available ye 2. You do not want a country to progress with this. The death can be avoided. Empano baako ye seng. Edi entina yetimi spendi sika 8 million a day to corruption. Ye area sika 8 million. Na yentimi nto empa enwu ye hospitals. Yet me expand a hospital intino. You and dear Omodiama World Health Organization threshold say or my biano Ghana knew half the quality of beds in the hospital. And by this time, that's why I campaign to touch champagne. Ebo shire kwaje bosia ba o mai muha. But nipa 10,000 biano pege Ghana health statistics omodi abano. Nipa 10,000 bia omoye empa available to them no. Eye 2. Nti se mu nyina mo yare bomwa de ye catch on say this is the situation in Ghana enyame na America. The whole of the country government hospital beds say aban dia 14,760 beds. The whole country aban dia wo mu no se nya mission fo yi ne private hospitals bi na eso ni pass na no so untumi ntua aban ne mpa ne no 15,000 beds for 35 million people. 15,000 beds in Empire wa Ghana. In 15,000. The government's bed. Hospital bed. In 15,000. Na sa 15,000 and 14,760 na ye kano. Emusa na air function. That is the big story. Empano yako kain. Na empane bi kura nye juma. Tete empane bi. Ene yedasu yusu. This is the situation. Ti ano pe obi yare kura no oko hospital. On one kasa hospital now okono edika bunabam and research has shown say hospital environment krano emanipa ayare santentem obi ko hospital no yare a environment na okosa ne ho yade wo mu no emane ho to ne ntem nti our leaders are not privy to the fact that 10,000 people are only having 2 available beds every 10,000 sick patients no omo 2 available beds. Are they not aware? Say, oh, share oxygen asamani e Kenya. Ghana da su puli oxygen and Abraham did this ankomono. Many nurses bear 5 almost 1 free Ghana makoye jumawo. National Health Service or UK din komo. Some of the things that they are saying is that by this time, all the for da so puli ade any friend say oxygen na what tank mono. Because ye ni bi wo ward bi ntie me puli abe say 20 minutes here they call another ward because nti obi wo oxygen sine so wabusuafo free ne nkyɛn wo se yetu ne de kɔ another ward oxygen keke wo and oxygen no enya de bi abro so enti ya de anka every hospital bi e wo Ghana ha bi a ward bi ano eni kura na nka bi a 2 oxygen si wo because nipa bi awuwu a na nsɛm fata so omuwu nti ube hu se nurse fo na etwe oxygen no wo ward no mo de ko ube hie omo no e kyese ward no mo de ko na bi ni ho no matu afidi oda ho ne so sa ne ho ato no ne ho nto no there is an emergency after emergency obi de ne emergency more nti mo ma hu bi da no ube ko ne 2 oxygen afiri obi so am na wu enye doctor fo ne pe o ye ni bi but he spend sika on unnecessary things. Health enye important emaye but the most important thing in this world is our life. Enya no ne hia ye mpanyimfo no because they can fly out of the country. Nti doctor for 4 of them from Kolebu Rage speaking to me Tamale Teaching Hospital, Sunyane Teaching Hospital, Government Hospital, Takrade, and some more can nyina the same thing. who's sending a message, Doc, I want to speak to you. What's the situation of your hospital? No, I Niama no all listen no. San almost say cotton wool. Omudu omusi kaneto. Cotton. Our Ghana hospitals. Adia bakwa. All the doctors sent to me. Adia be a friend of defibrillators. Yes, they show akumum AED. So obi anya cardiac. Akumayadi to me see. Sa defibrillators no. Ghana hospitals no 90% NEB. Say akumayadi account no yes what 10 minutes I'll bet my survival 10 minutes akumayadi be atwe mu odu no at least that machine no ya design say my electric shock na brechi wona mabonten kra say bi wo shops bi a obi collapse out me room na wakwa bi ne bo nya den 90% of hospitals in Ghana omuni AEDs ne bi 90% enti akumayadi account ya di udu wa ni epia obo ho ni ekun kra ka ho. Basadi no corruption is can be to be a supply the entire country. Enti your health no en hia yesa. Mame for mu no en hia yesa. So wo hwe AEDC America ye de hye akomoma. Springer report of 2022. 90% of health facilities in Ghana omunibi. Na sa Springer report omo health risk omo say the enti omo yere so omo de ma akwantufu omo ba Ghana ye kyerem oman a omo health system enye Ghana eka the worst 20 ho in the world. Yeni Togo in Africa no yeni Togo, Sudan, Nigeria, Benin enti obi tu kwa Ghana no akwa internet ne so no akwa Springer report say oman na me kwaso no se bibi kotomi wo ha. Will I survive? Ya rated Ghana say yeah high risk country in terms of emergency. Yeah, was describe it as worst emergency healthcare in the world. Ghana was the lowest bottom. Our leaders are aware. Say you need AEDs. 90% of the hospital they chama kumamu cry fridge. Fridge I didn't know gumno. And do be you see a fridge be say cold chain. A do be oha a particular temperature. Inti eno no ye wone fridge a ye di gum to say a normal fridge you know ye will be AEDs in a bi na mo hwe no machines are patient monitors we de ma munru hokra na ye ni AED ye ni AEDs enti we de kra mo komonim chese ye do level a Ghana entumi ento cotton wool our hospital towels bedsheet ye de obeto so no emu bon to the extent say wo kra wo da ho no wo sa ayare biem what the area na eba fie nti doctors ni nyina unanimously o say Ghana ye was sick hospitals nti patient na mo ya sick amoba no mo ba into a sick facility and we know report na ye kan nyina kire say they are aware Ghana Health Service o mo ya aware Ministry of Health o mo ya aware nti aban bi aba nko be free so no yes o provide AED sen oxygen sen was supply to hospital and just o person o save yankwa bed sign na odi aka ho because you should be able to provide 100,000 beds. Ghana buy bed the whole room and nipa 35 million no a new 15 million 15,000 beds. And I will say to me provide bed near 20,000 crack kan one not just say 25,000 beds and you say afede ye move step aban o twa mu ambulance na ye 88 the whole country e bi kura break ya manaka be 50 and ode over 300 was the same home. That is an improvement. Nanka di oba ye ono so nkonko yesi e to Land Cruiser ne hwan na wa cut it down cost na ye cut for ministries no ne ya cut ministers ne so ne ya cut cost no ne yesi de akoto ambulance 500 and also amani bi was 7,000 ambulances ye nyanru 500 nti si akoto ne nya 1,000 ambulances a ebe save maami wo baabi ebe save papa wo baabi ebe save wankasa wo baabi. Because Krom ha yehu obi oya vice president awa collapse ya. Ye de na to pick up to because oma hu se sa niema we no e wo se ambulance de nka community bi ebisi wo enya de bia. Se de ehu Pajero any Land Cruiser or community bia no we should see an ambulance in every community. Enya de kese bia. The fact that every community you can see a government Prado V8 no it is also possible to have an ambulance in every community. SMC ya be 200 meters from you, 1 kilometer from you. Nti aban na okona ye bi no, nanka we so the 500 abeka woni a say health system no, ye prioritize it. personal protective equipment. Nurse for ne say, mo amudi o matem Ghana nurses enye Ghana nurses enye no. Uko UK, there are more Ghanaian nurses in UK than in Ghana. For those who don't know, Ghana nurses say yeah, juma omo numbers omo UK no omo doso cho omo Ghana Health Service. Na omo ye high value House of Commons in UK. Omo edidate omo de buy o Parliament House na UK dey you know. Ba ko dia ba say Ghana nurses say high valued because of omo skills. Entenya what is say UK ya bibie dia ba say nurse bi o UK wakọ pan ye bone wakọ ye TikTok am ya che no. Ghana for nurses na ne ho ade no omo ko omo nye TikTok. Facilities ni bi ni ha ntenya nurses for na abon o ye omo nye, but generally we have very high skilled nurses. But oko hospital ha gloves scrub gloves ebi ni ho. O nurse ni ono kwa na adwuma no okwa so san akotwe oxygen na eso no mahu obi a wawo a akora ne bo nurse ne bo na oxygen se kuta nurse no wo twe de na ko incubator na de me ya ne se northern region region upper east asama asi wo ho a wo hwe DW report o me de ba ya the whole of the region 6 districts only 2 incubators several 6 districts 2 incubators. The research has also shown say enkra ye wo mo Ghana no 14% ye preterm into 100 bia emu 14 to 15 ye wo mo before omo due date less than 37 weeks. E just say ye wo preterm baby say wo ye system no ma da ban no e ya aware based on research. By incubators e okroma no radio presenters and stress bi o air na politicians na beda ase radio presenter ni fundraising ekoto incubator na health minister beda ase she sika covid time yekoto nro corruption ho nsensem ewo mu no eniama na yebetimi di ato no yenye enti doctors ne se yanka bi mo say your health system no very sick. Mede we twato. The nurses are complaining that they are not doing well in Ghana because of what they are supposed to get in terms of working, the equipment and facilities or the momo. Omunibi. Enti abaso omachina yebo bebrebe no. Yenya abotreni ente. It is not them, but it is the system and amo mayesa. Wo share eniem chese uba ambulance, uko incubators, uko a lot of the things fridge. 10% of fridges and ye adwuma wo Ghana hospital 10% fridge ye di nrogum no nti aduro no be nom no na asai ye di amount ye ba wo be nom na asai only 10% of fridges and ye adwuma wo Ghana hospitals. This is Ghana Statistical Service report anyame na meka 10% of fridge wo hospital wo Ghana fridge kwa wo opanyi bi fie fridge 10 de edi nam gum baako de edi nsuo gum de edi nsa gum na onim so sa panyi no onim so collapse a the yehu nipa bi okrum ha wayare ewo kumase wayare wo sunwan but ye de ne beto ka ma fly de ndakwa bruche because ono ankasa trust sunwan hospital anka sunwan ni o se CT scan wo ho ye wo x-ray machine wo ho niam ye basic no ho anka yamfa won to ka mu hwi MSN fa won kwa bruche u betwa 6 hours ewo wiem ewo abra quality doctors wo ha omuko UK omo ye the best. So we are talking to the politicians. Omoma ye who the tangibles say. Eniama we ne ye pese ye na ye improve mo health because nipa no mu wu hospital no bebre avoidable. Nipa amoko wu hospital oda ni nua nan so oda ne papa nan so oda ne papa da ne nan so ne maame da ne nan so no wu because ye say empa ni ho. Nipa 10,000 bi omo Ghana no empa ye available to them ye 2. 10,000 people omo yare no. Empa ye wo ho ye 2. Now 10,000 people sharing 2 beds. That is the system we have at the moment. Till the doctors are complaining. Almost a hospital environment in the whole time. And this is Kolebu this year. Now here Kolebu 1932. Never compare say, oh, ko wenima na oba wachi. Now no day made the video tune for this is 1932 Kolebu female ward. Now she ene. No obisa who say oba no or ko nenima na oba nachi. Otun force 82 renovation or yen work on for noche no. So we before, now we after. No who says who read before now we won't tell after no. Because hospital now who ko urano. Yari e wo no doors so chen de wo de ko. empani bi oho etwawa eno aho tetanus okra so different. We have a big problem with our health system. Almost say sick hospitals and entertain welcome sick patients. One is son of yonko yade. Nti health minister kwabena mita kando enema bi ho ayabo so incubator ye be hu yes o de 10,000 aba Ghana. Ni ehu se wo be improve no by 100%. What the CT scan about hospitals e wo ha. Personal protective equipment, gloves ne cotton. Ne sa ne ma wo de biaba. What the fridges fridge na no mel comfort ne koche Ghana hospital 25 fridge omuni baby omudi omun logo fridge AEDs adia e de shock akoma ekutenkete o nketenkete ye nibi ene hospital na sisi wasa ye de okwa na doctor for use manual nti omunyi na agya kwa abrichiri because you cannot. This is comfort noche nti yemfa abasoboma otumfo because sa hospital we na ocean before champagne wo hono ba ku bi o ha 12,000 cedis we na ya adjust no we yare etimi adjust won move we dware na ya obibi akama. This is a hospital. Se comfort no chi politician bi ayare betimi do akọ ha de aye no hoyi ba ku no won na ho but o ka ne bo hwe na onim se obe collapse one day she say na na hotel wo she before pictures. This is how we should, the level we should get to, Nana.